Trauma. Odds are you or someone you know has been affected by trauma in their lifetime. Anything can be considered a trauma. An estimated 70% of adults in the United States have experienced a traumatic event at least once in their life, and about 20% of those people go on to develop post-traumatic stress disorder. Post-traumatic stress disorder is defined by the Mayo Clinic as a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. Most people who go through traumatic events may have a difficult time coping, but with time and good self-care, they can usually recover. If the symptoms get worse and last for weeks, months, years, and interfere with people's day-to-day functioning and living their normal life routines, post-traumatic stress disorder may be something that they're experiencing. So we asked student, friends, and faculty if they believed that people who have experienced a trauma must fully process the trauma to improve. Here were their answers.
Yes.
Yes.
Okay.
Yes.
I would say yes.
Yes.
The results were conclusive. Almost everybody we interviewed said yes, that they did, in fact, believe the myth. So the next question we asked them was why.
I think that when you have something traumatic happen in your life, you need to be able to like emotionally and psychologically process it, to be able to kind of figure out like why it affected you and how it affected you, so you can kind of get past that and like grow from it.
I think it allows for people to like fully comprehend all the emotions they're going through and then kind of process one each and deal with it as it comes up.
I don't know. I'm not a psychology person. In order to understand the trauma, you have to know why it happened, how it happened, and how you can recover from it, or how you can help other people recover from it.
Very well.
There was clear consensus among everyone that we interviewed about why they believed that the myth was true. This led us to ask the next question: where? Where did the myth come from? We examined popular TV shows, movies, and social media to try to find instances of where the myth was perpetuated. The next clip is from popular TV show Grey's Anatomy. The clip shows main character Meredith Grey undergoing therapy. Her therapist is pushing her to recall past traumatic experiences that have affected Meredith. As we can see in the clip, Meredith Grey is being pushed to recall specific details about the day that her mother attempted suicide. Although she does not want to share these details and is made clearly uncomfortable, the therapist pushes her to recall. The next clip is from another popular TV series, Criminal Minds. In this scene, Agent Jennifer Giroux is given a complete file on her attacker by her friend, Dr. Reed, in hopes that confronting the file and everything in it will help her resolve her struggles since her abduction and torture. As seen in both video clips from the TV shows, both subjects were forced to fully confront their past in great detail and their past traumatic experiences in order to fully recover from their trauma. At this point, we've examined the origins of the myth, what people believe about the myth, and how the myth is perpetuated in common social culture. Now let's look at the science behind the myth and how the myth has been debunked. In order to look at the science behind the myth and behind why the myth isn't true, we examined 3 separate psychological studies that specifically handled trauma and trauma-related treatments. The first study was a study completed in 1999. It was a randomized, controlled trial of individual psychological debriefing for victims of violent crime. The idea was that giving people the opportunity to talk about a traumatic event may lead to the prevention of future traumatic disorders. So, essentially, by going through and describing and reliving the event in detail, participants would be able to prevent the later development of post-traumatic stress disorder. This trial was done by taking 157 individuals who had been the victim of a violent crime in the past month. They were randomly assigned to 2 groups, either to an education condition or a psychological debriefing plus education condition. The education included information about normal post-traumatic feelings, reactions, and responses. Debriefing included in-depth discussion and probing about the events leading up to and including the trauma, the thoughts and the emotions experienced during the trauma, and the memories surrounding the trauma. The subjects were interviewed in their homes and were followed up with at 6 and 11 months. The results of this study found that there was no evidence that found that this theory of psychological debriefing or reliving this trauma aided in any way in preventing post-traumatic stress disorder or helping the participants of the study heal from the trauma in any major way. The next study was one published in 2001. This study focused on the effect of timing of critical incident stress debriefing, or CISD, on post-traumatic stress symptoms. This study involved 70 people who had been victims of armed robbery. They were assigned randomly to 2 separate groups. One group received immediate debriefing, and one group received delayed debriefing of the traumatic incident. The group that received immediate intervention showed lower numbers and lower severity of symptoms of post-traumatic stress disorder than the group who received the delayed debriefing. Although this study does nothing to disprove the myth directly, this study does relate to the myth, and it could possibly be a reason why people believe the myth today. The study basically says that people who receive immediate intervention, even if that intervention does involve deep processing of the trauma, they're better off than people who receive later treatment, no matter what type of treatment it is. This could be one of the reasons why people believe the myth today. The next study that was examined was a 1996 study. It was a randomized controlled trial of psychological debriefing for victims of road traffic accidents. The study's aim was to examine the psychological issues that people face who have been involved in either major or minor car accidents and the trauma that they experience. This study was examining preventative measures, specifically the preventative measure of psychological debriefing. Psychological debriefing is the widely used process in psychology that attempts to stop the effects of a traumatic event or the later development of post-traumatic stress disorder. The procedure largely involves the encouragement and normalization of shows of emotion and renderings of past traumas in great depth and detail. For this study, they used subjects from John Radcliffe Hospital. They randomly assigned them to either an intervention group or a control group. They did this using a random number generator. The people who received the intervention group received an hour of intense debriefing, which included a detailed review of the traumatic experience and an encouragement to express feelings and promotion of processing the experience. The control group received no treatment whatsoever. The results found that the group of intervention has a higher injury severity score. That means that they rated themselves as being more injured and having a more traumatic experience than the group that received no treatment. And they also were in the hospital, on average, for a longer period than those in the control group. But other than that, there was no difference between the two groups. The science behind this myth clearly debunks it. The National Institute of Health even says on their website that despite the widespread use of psychological debriefing, that serious concerns have been raised about its effectiveness and potential to do harm to patients rather than helping. Trauma affects a lot of people, and it affects a lot of people in different ways. People who have experienced trauma are 4 times more likely to become an alcoholic, 15 times more likely to commit suicide. They're at risk for a world of consequences if left untreated. Because of the importance of treatment in this condition, it is so important to understand which treatment works and which treatment is going to be the most effective and the least harmful for people suffering with trauma.